Hi guys, this video is about semaglutide, commonly known as Ozempic or Wegovy. Semaglutide is a synthetic version of a naturally occurring hormone called GLP-1, glucagon-like peptide, and this hormone works on centers of your brain to decrease hunger, to slow down the passage of food through your digestive tract, and also to regulate the release of sugar in your bloodstream and therefore regulating your insulin production. Basically, anybody who has tried losing weight in a more traditional way and are still struggling. So that means watching what you're eating, trying to exercise more, counting calories, all of that. Semaglutide is best used in conjunction with healthy lifestyle changes such as mindful eating, eating healthy, and adding a good bit of exercise to your routine. It is administered via a weekly, so once a week, subcutaneous injection, so injection into the fat of your skin, with a pen that has a really, really tiny needle. The needle is so small that you honestly barely feel it when you do it. It's very, very easy to do. For the majority of patients, you see results in that first month. So that's either starting to lose weight slowly or stopping your weight gain, so plateauing. For some patients, it does take a couple of months and a couple of dose adjustments to get there. The most common side effects are digestive in nature because semaglutide delays that passage of food in our stomach. So you can experience things like nausea, maybe a little bit of bloating, sometimes diarrhea or constipation. Generally, they're pretty mild and very well tolerated, and people adapt to the medication and don't experience them anymore. In some cases of severe nausea, it can be treated with an anti-nausea medication called Zofran, but that is rarely the case. So some of the rare but serious side effects of semaglutide, and luckily they are very rare, are things like gallstones, gallbladder disease, and pancreatitis. And this is why I do a full blood panel before discussing starting you on this medication. And in some mice models, but not in humans, it has been demonstrated that this medication caused something called medullary thyroid cancer, which is a very rare thing. Semaglutide should not be used in anyone that has a history of thyroid cancer or a more rare type of cancer called medullary endocrine neoplasm type 2. It also should not be used in anybody with a history of pancreatitis or gallbladder disease or anyone who's pregnant or intending to become pregnant. The health benefits of semaglutide when used appropriately are enormous. If you are overweight or obese, even losing, 5 to 10% of your body weight can have a tremendous impact on your overall health and the health of your organs, and it can actually eliminate things like diabetes and hypertension.